it will be effective September 8th of this year, and it must be fully operational by September of 2018. However, the powers that be would like to have that done earlier. There will be rules created and they're working on them now. We've met with the Board of Pharmacy about some of the rules that they're looking at. The Ohio Department of Commerce, as well as the State of Ohio Medical Board, are all looking at this issue and have to have certain rules they have to write. The Board of Pharmacy does the medical piece. The Department of Commerce does the business piece, seed to sale, and then the State of Ohio Medical Board actually creates the training that the doctors have to go through to recommend medical marijuana. So how do people get marijuana in between? Well, they did put in an affirmative defense for patients and caregivers, which means that if a person has medical marijuana or marijuana, it's, I guess, considered to be medical. However, I don't know how this is going to work because according to the law it says it must have a physician's recommendation, and before the physician can recommend marijuana they have to take a 4-hour course, which has not been even created by the board, by the state medical board. So this is all kind of the it's just a big gray area. I don't even know how it's supposed to happen, nor does anyone else, quite frankly, that we talk to. They said one of the senators, Senator Dave Burke, said that marijuana can be brought in from other states. However, this actually violates the Cole memo, which is the memo from the Department of Justice, which says that you cannot transport it across state lines. So if you went to Michigan, their law says that you can't transport it anyway. And in Colorado, you can't transport it because it is federally Schedule I drug, which is illegal. And the DEA within the last month reiterated that, reaffirmed that they're keeping it Schedule I, not changing it, which says it is highly addictive and has no medical benefit. So if we want to go to the next slide. The missing pieces, again, this is a recap from the last webinar. There's nothing about advertising. They're having to consider that. We've talked to folks at the Board of Pharmacy about that. Delivery services, this is going to be something where you can order it from an app. What is a 90-day supply? That has to be determined by someone at the medical board with absolutely no scientific process put into this. We don't know the taxes. We don't know how many dispensaries will be allowed. We have no clue how many cultivators, who are the cultivators. We just don't know any of this kind of stuff. There's also a caregiver option, which is, a person can have so many people that they administer medical marijuana to. So wanted to give you that little tidbit that they could have 5 patients, which means they could have enough marijuana for those 5 people. It just is a very, very gray area, this whole thing. So we on the next slide, and this is what I think that we have to start showing. A picture. What is that word? That phrase? A picture says 1,000 words. Start showing the marijuana shops that are out there in Colorado. These are actual marijuana shops in Denver. Next slide, please. And then the advertising. Are they going to allow coupons? Are they going to allow these things to take place in newspapers and magazines where you can get supposed medical marijuana, but then you get a coupon? Not too many people, I think, have coupons for Adderall or whatever sinus medication, any penicillin or anything like that. So I think these are things that we really have to consider when we're trying to push information. And again, pictures speak 1,000 words. There's even the one picture in the middle, upper middle, that says that you get free marijuana, an edible of your choice, if you buy a washer and dryer from this manufacturer, which I think is quite funny. So it's those types of things. So how does this impact other businesses? Will they be able to, will Maytag be able to give away a free 8 or an edible if you buy their dishwasher or something like that? Again, things that nobody ever considered, but something that we need to, because we've experienced this in Colorado, and the market will bear this here in Ohio. You know what we have is we have a couple of great guests that have already been doing some work around the state and in their community for the medical marijuana, trying to get an ordinance put into place. There are quite a few ordinances that are temporary moratoriums, usually about a 180-day moratorium is what I'm seeing from several communities across the state of Ohio, which means they don't know what they don't know. So we have to be in there right now to educate these folks, to let them know exactly what's going on, and to help us out today to understand what is going on. We've got a couple guests. The first one is a good friend of mine. I've known her for, as all of you, I've known her for, I don't know, probably 16, 17 years. Nicole Schiesler from Prevention First down in Cincinnati has been working on this in her own community, and would love for Nicole to tell her about her experience in trying to get an ordinance and some action in her own community. Nicole, take it away.
Good morning. Thank you, Tony. My name is Nicole Schiesler, like Tony mentioned. I work for a regionally based community coalition in greater Cincinnati area. We serve the 10 counties where Kentucky, Indiana, and Ohio converge. And what I am bringing to the webinar today is hopefully probably where a lot of you are. At Prevention First, we focus on alcohol, marijuana, and prescription drugs. Ton of resources, ton of things going on with prescription drugs right now. Alcohol, of course, is still our leading drug for that use they're using. But marijuana, we've done a lot of advocacy, and our advocacy is, just continuing to push for the harm. But beyond that, we really have just been taking in the materials that's provided by Drug Free Action Alliance and just trying to understand what we can do. So we organized a workshop at our Coalition Academy, which is taking place on September 20th. And in that was two presenters, Christy Valentini and Mary Wolf. Christy's from the Hamilton Coalition in Butler County, and then Mary's from the Claremont Coalition in Claremont County. And they're speaking about the city ordinance that Christy helped pass in Hamilton, and then Mary Wolf is a township trustee in Claremont County, but she's also the director of the coalition. And she's been doing some work. So from a personal standpoint, I said to myself, I'm going to try to start a conversation in my own community, which I have never done. Very good at working in other communities and informing people of what they need to do, but I felt like this was very important for me to do something in my community. So that's what I wanted to share with you today, is just what I did, what I took, and where we are now. So I set up a meeting, really just did a Facebook message to a township trustee in the community that I live in and asked him for, half-hour, 45-minute conversation about medical marijuana. So I went, he actually brought in the township administrator, and then I also had with me, in Warren County, we have a small business development grant. It's a grant that's funded by the state, and they help provide resources to small businesses. So I was pretty certain that that person would be hearing from people who wanted to start a dispensary because, it is a small business. So the speaking points that I took with me are one that was provided by Drug Free Action Alliance. It's called Talking Points for House Bill 523. Additionally, Tony sent me a PowerPoint presentation, Marijuana in Ohio. And then by the grace of the powers above, there was an article in the Cincinnati Enquirer that day that was talking about what two other townships in our area were working on in regards to this. So I took that as a resource as well. What I found to be important was stay in the lane of what we can do, because I could find the conversation going in a lot of different directions, saying, well, this is that, and we can do this. And so I really just went in there solution-driven, what we can do, here's what we're facing. So I talked a lot about, what has passed, what's going to happen, and then I tried to think about what are some of the things that they care about. I focused on the facade of stores in the community. What do we want our township to look like? What communities can do, or what we're up against, what we're kind of looking at with this. And then I said, really what I'm asking of you is to start a conversation today about a local ordinance going into place to prohibit the dispensaries in our community. So in those speaking points, it did say dispensaries cannot lie within 500 feet of a school, place of worship, public library, playground, or public park. So that's what I went for. And we talked about what that could look like. And it wasn't easy. I'm not trying to pretend like, we all held hands and whistled out the front door, because they did have a lot of comebacks. They referenced the media. Well, if the media says that, this is medicine, then shouldn't we listen to them? And so I did try to counter that and say, that there is scientific evidence and some of the speaking points that we've learned through the years. And again, I stayed in that lane of what we can do. I can't control what the media is doing. I can't control why they made this decision, but the point is they made the decision, so what are we going to do to counter it? So when I left there, I honestly didn't have a very good feeling, but they were able to, I got a nice thank you note, and they said, let's see what we can do about this. So my action steps afterwards were I also sent them a thank you note. I asked them what they needed from me to continue the conversation, and then that was how I left it. So they actually responded back, and they said that the law director was looking at it, and this has all been taking place since like the first week in August. So then I just got an email last week stating that the law director had reviewed it and the township trustees voted on making a moratorium. I consider that a huge win, because if you think about it, when I walked in there, they knew nothing about what this was, how it could impact our community. So I felt very proud of the fact that, the conversation started. So I did, a moratorium is a temporary prohibiting a dispensary in our community. So what they were saying is it gives them a little bit of leeway. So if a dispensary does approach them with this ordinance or this moratorium in place, they do have some give to come back. They don't have to accept them right away if they choose to or not to. And again, another article had come out in the Cincinnati Enquirer about what 2 other townships were doing. Additionally, I wanted to rely on the support and the resources that we do have in place as community coalitions, because I know that prevention does not always have a voice. So I wanted to show that we do have, a good support system. So I contacted the Warren County Coalition, and I put them on all the emails. I put Tony on all the emails, because I wanted to see everyone just kind of see this process. So I did ask them if I could attend on September 7th to watch it go into place and really just watch it from start to finish. So I have invited, anyone who wants to go, but a couple of the people from Warren County might be coming too, as well as Mary Wolf, who's another township trustee, because I found that they respect peer-to-peer so much more. Not that they don't respect me, but they just respected that fact that I knew another township trustee and that we were all kind of in the same boat. That's all that I wanted to say. Tony, or Brittany, do you have any questions or anything else you would like for me to touch on?
I think that is phenomenal information. The process that you went through, and sharing that it was frustrating. I remember the day after it, there was frustration, but they did issue that moratorium. So your work, even though at first it was you felt like, I think, banging your head against a wall, it really did work. People really did listen. So I'm really, really thrilled with what you did, and thank you so much for sharing this with us on this call. You do such great work down in Cincinnati, and if you haven't already, sign up for the Prevention Work Coalition Academy, and I'm sure you can get that right on Prevention First website, correct?
Yes, and so I have actually invited our township trustee to that. I want to include them. It happens to be in my community just by chance. So I want him to, to be engaged in this and care about prevention, and just, not let it lose the value of it. But it was pretty cool, because since I follow him on Facebook, I can see his report that he gave to the township. And among, 5 or 6 other things, right there in the middle was the discussion about medical marijuana. So I was pretty amazed at that.
Excellent. So thank you so much. And then, so we also have another special guest from up in Akron, and she has a great deal of experience as well with coalition work. And Shelia, are you there?
Yes, I'm here. Can you hear me?
Yes, Shelia Smith from the Summit County Partnership up there, and take it away, Shelia.
All right. Good morning, everyone. I am the projects coordinator for Summit County Community Partnership here in Akron, Ohio. Our county is about 500,000 in population, rural, urban, and suburban. We have not gotten quite as far as Nicole has with their move on the medical marijuana, but we do have a medical marijuana subcommittee, which we've had one meeting. And one of the things that have come out of that meeting is the general consensus that we would like to see that the guidelines not be loosely open and shaped to make sure it stays medical and not recreational. Now, we are looking to do what Nicole has done with our elected officials. We have Summit County Council, we also have the Akron City Council, and there are other townships that we would need to address. But we want to be able to use what Nicole has shared to go forth with our elected officials. Now, in just general conversation with people that I know, I did ask one elected official what did she know the status of medical marijuana. And of course, she didn't really realize that the governor had signed it into law. So we have a long way to go with some of our officials. We also have involvement on our coalition, representatives from a orthopedic surgeon group. And it's reported there that they do not want to have anything to do with making recommendations for medical marijuana. I also was able to go to a MS meeting, multiple sclerosis meeting, with a friend of mine who invited us. There was a neurologist there that's testing a new medicine that he was unveiling at this particular meeting. And he said that people were lining up for a recommendation for medical marijuana, and he says he wants no part of that. In the local community, because I'm involved in a lot of different parts of the community, I spoke with one person who's well known in the community and also a well-versed in union relationships. And his response was, I thought we voted that down. So there's a lot of work that we need to do here in Summit County, and hopefully to use the format. I love what Nicole is doing in Cincinnati, and we'd like to replicate that. But I think we're kind of starting at ground zero about what the community knows about this medical marijuana.
Shelia, thank you. And I'll tell you what, I think that is such an important point, because I've had the same experience speaking with an employer, and I said, so you getting ready for the medical marijuana? And they're like, what are you talking about? That never passed.
Yeah.
And so it is the same type of thing that, there are community members that don't even know this is coming down the pike. So even getting the word out and providing that, that public awareness that this is going to be happening, I think could really go far in helping our cause. Because this did come in like under the, the cloak of darkness, or whatever that old saying is. So I really appreciate what you're saying, and I think it's a brilliant strategy to talk to your docs and talk to those who would have the ability to recommend medical marijuana, and perhaps get them on board as well.
Yes.
So any questions or anything for either Nicole or Sheila? Brittany?
So far, we are getting just a lot of appreciation from folks saying thank you for sharing the step-by-step model. One of the things I think is so powerful about what both ladies shared, they're taking completely different approaches with different people, and I think that's what we have to not be afraid of in our local communities. It's not going to look the same from town to town or county to county, but anyone can do this work if they've got the passion, and don't be afraid to ask who your friends are, and so thank you so much, ladies, for sharing.
Thank you.
Yeah, thank you so much, both of you. You're doing phenomenal work, and it is. I think it's really going to pay off. So I can't thank both of you enough, and for everyone for doing the work that they're doing. I got the many of you did got the email from I think it was Licking County, Johnstown, a little town in I guess north central Ohio. Got actually embraces medical marijuana because of a business owner there who is going to be making money off the oils and all of that kind of stuff. So they're actually welcoming medical marijuana businesses. And Licking County is not just sitting there. They're trying to bring awareness. So there's a lot. Every community, I think, is at a different stage on this issue. Some don't know about it. Some are well-versed, and some are in favor, and hopefully some are, I think a lot of them are opposed. So, but it's really our job to educate, because again, a lot of these communities have moratoriums, and they want to learn more, and they want to be educated before they make that final decision about allowing these types of establishments in their community. So, grand work to everyone. Some of the next slide, if we could. Some of the local ordinance considerations, as I've studied some of these across the country, especially in Colorado and California, they really focus on cultivation sites. The odors from cultivation has been a big issue in some Colorado towns. The sales and dispensaries, obviously. When we talked to the Board of Pharmacy, one of the things they were going to try to really push in their rules is to allow no neon lights for a dispensary. Advertising, I showed the advertising earlier. It's delivering and transportation. For some, it's as easy as getting like a Domino's pizza. You make a call, or you go on an app, it gets in, and someone brings you pot. Also, the use. Colorado right now is fighting marijuana clubs out in their communities, and also testing facilities. Right now, I think in the language it says that the first 2 years, colleges are the ones who will be the testing facilities, but then it will be expanded after that. So those are some things you might want to look at with your local ordinances. And again, anything we can do to help you, anything that I know that Nicole and Sheila also good resources. They've been through it. So anything, we're all in this together. Let's not try to reinvent wheels and all of that kind of stuff. We've got a lot of resources at the FAA. We've got a lot of experience and resources at Prevention First. A lot of resources and experience at Summit County and so many other communities. So this is something that we really, can work on this together and not feel like we're alone. And finally, to wrap this advocacy call out, really quickly wanted to mention so Attorney General Mike DeWine had a press conference with Speaker Rosenberger and Senate President Faber about a week and a half ago, and said that he wants to have prevention curriculum in schools. Now, this, I think, is in response to the, quite frankly, the lack of direction in the bill that was passed by Robert Sprague about a year and a half ago that required schools to have some kind of prevention curriculum in their schools. Doesn't say what grade, doesn't say anything. They actually want a K through 12 kind of curriculum. So they have put together a committee, which is not met yet, but they plan to, and hopefully will have something out in 90 days is what his Attorney General Mike DeWine's timeline is. I don't think that's feasible, but God bless them. But I do think that, for the first time, we've got some really good people on this board. We've got Sherry Walter from the Board Association, OACPA. We've got Molly Stone from OMAS, the Chief of Prevention. Marcy Seidel from Drug Free Action Alliance. We've got a number of school officials from across the state. The thing that we're asking you to do is there's going to be an opportunity for testimony. We are going to need every prevention person that we can to testify on behalf of this. I think we could have a strategy type of meeting to talk, to kind of get our points across. But we really need to do this because, again, a lot of these folks think prevention is either having a not car crash or having some kind of one-time event. Red Ribbon is a popular event, but it's not, 1 week, as everyone knows, it does not make a substance-free child. So just really something that would really love for everyone to have testimony. And when we hear that, we'll be sending that information out so that you can provide either written or I think oral testimony in front of this committee. So I'm very happy that they're looking at prevention. Also, the Health Policy Institute of Ohio announced through some of their recommendations that the health issues impacting Ohio, number one was chronic disease, number two was addiction, the prevention, treatment, and recovery of from addiction. So please, this is something that has been given to legislators, has been given as action points and funding priorities to these policymakers. And as we enter next year, which is the big budget, actually this fall they'll start talking about it. These are the things that folks, the legislative folks will be paying attention to, listening to. Again, this will be our opportunity to get some funding for good prevention into the budget, hopefully. So those are some things I really want to, on the last slide, I think it says action needed. The action is keep doing what you're doing as far as marijuana. Keep getting out there. Keep educating folks. If you need tools, let us provide those. I just got, within the last day, some new stats about drug driving and things from SAM, smart approaches to marijuana, and some of the arrest rates and all of those other types of things going on in Colorado and Washington. We encourage you to start writing that testimony about what would be in a good prevention curriculum, K through 12, for schools. So if we've got an opportunity where the spotlight's on us, we have to now deliver. So I thank you so much for all that you're doing. I didn't know if there were any questions or anything before I get on this big old bird and fly off to Scranton, which I've never been to, but I'm sure it's a lovely city. So are there any questions or anything, Brittany?
We do have a few questions coming in, and several of them are about how they can access some of the different tools. You have on your screen now, and this did go out on August 10th in the SPECA e-news alert for those of you who are SPECA members. We have established a Dropbox account, which we will be regularly adding to with regard to tools, timelines, outlines that we receive related to this issue. You can download the community presentation that Tony presented in July and has tweaked and added script notes to. I also received a question about whether the talking points for would be available. We will add that into the Dropbox there. Our goal is to make this equally available to all of you with the most up-to-date versions. So we'll be maintaining that Dropbox account. If you have any issues accessing it or the content or anything of that nature, you all know how to reach me. And if you don't, track down Tony and he can find me too. One additional question that we had, Tony, that I think everyone's concerned about, we had a question about whether or not a coalition that is DFC funded is able to go out and educate at the local community about where we are. Could you speak to that?
Yes, they can absolutely educate. Any of the tools that we provide is about education. I really don't encourage anyone to try to write a local ordinance because that is a lot of lawyer speak and you know, some of those fine-tuning things. What we can do is introduce subjects that may be included in a local ordinance. So, you know, talking about drug driving, talking about crime rates that are going on in around especially dispensaries, talking about usage rates. All of that is education. I wouldn't go near, you know, I wouldn't go anywhere near trying to write a local ordinance. That is up to the city council. That's up to the lawyers and the legal people. And so all of this is absolutely advocacy and educating your community on things. And to the point of Shelia, you know, a lot of people don't even know it's coming. So even just saying, you know, House Bill 523 did pass. That's not lobbying because you're just sharing information. But this law has now passed. What do we do with it? So none of that is lobbying. That's all education and advocating for safe communities.
Thank you very much, Tony. And then a final question, just to clarify, you had mentioned something in regards to medical marijuana and its relationship to addiction recovery communities. Can you go back and circle back to that for us?
What was the? I don't know. I may have been watching some. So what was the? Okay. What was the point about?
I remember you were mentioning medical marijuana and talking about how there was an argument connecting some of the recovery communities and whether marijuana was a viable source of potential treatment. I know that that's an ongoing, quiet conversation in different parts of the state. Can you just give us any clarification or update on that?
Yeah, I mean, you know, basically replacing one drug with another. This was, again, high potential for abuse. This is not the marijuana of the 1950s, 60s, 70s, 80s, or even 90s. This is some high power, you know, some pretty powerful stuff. There's absolutely zero scientific evidence that shows that marijuana is a viable option for opiate, you know, getting off of opiates, opiate addiction. There's absolutely zero evidence. In fact, you know, it's been misreported many, many times that when states have medical marijuana programs, that somehow their opiate rates are lower. Well, what they didn't take into consideration on any of those, especially the one study, is that was put out there about a year ago. They didn't take into account any kind of programs to actually reduce opiate use. They didn't take into account any kind of medical-assisted treatment. And also, if you look at the raw numbers actually show that there's an increase in overdose deaths in those states. However, because of the way the scientists you know, took out some of those numbers and attributed to other sources, then that is when they showed that the numbers went down. There's a great, and I'll find it and send it to you, Brittany, if you want to add it to that Dropbox, that Kevin Sabet in the University of Florida did about that very issue. And looking at that study, and there are 6 points that he made. I've talked a little bit about a couple of them, but that is something that we can add to that Dropbox to refute those claims that somehow opiate use goes down with as marijuana use is encouraged in states.
Thank you very much, Tony. At this time, we do not have any further questions, but as always, you know, if you need to reach us, we are here. You may email, you may call. We did have one final request, whether or not some of our guest speakers today could be accessed. We certainly can put you in contact with them. And Nicole has already said that, you know, she welcomed the opportunity to share, as did Shelia. So we'll make sure that if you guys would like to speak with the ladies, you'll be able to do so. And with that, Tony, I have nothing further.
Thank you so much. Have a great couple days.
Thank you. Have a great flight.
Okay. Thank you.
Mm-hmm.
Bye.